Hello and welcome to another edition of the Dave Grant Cook Show. Whoops, that was the wrong one. Hold on, let me get the right one.
You stored that one up, didn't you?
Yeah.
Hello there, and welcome to the 24 Gauge Podcast. We are your hosts,
Dave.
and Julia Grant.
A couple of nurses who are also a couple.
We are Canadian RNs with 25 years of shared acute care experience who have built professional careers and a life together. Join us each episode as we have conversations about the real, the introspective, the deep, and the dorky of living life as a nurse. And with that moment of serenity, welcome here.
Welcome to the podcast. It's not Dave Grant Cooks. It's the
24 Gauge Podcast. I feel like in that pre-recorded intro, you can really hear my lisp coming out. And it's like particularly Eeyore of you, the way that you say that. A couple of nurses who are also a couple. Like it sounds like a depressing fact.
Yeah, it's true. What are we talking about today? So this will be
first
the
of all,
last one that we're recording for the year.
Last one that we're recording for the year, which we're probably releasing this at the beginning of 2023, aren't we?
Yeah, actually, this will be the first one of the year that we're releasing. And then after this, hopefully...
So we are speaking to the future right now.
This will be episode 5.
Yep.
Hopefully after this, we'll have video podcasts.
Uh-oh. Gonna have to get ready for that.
Yeah.
Yeah.
Well, actually, have to, dress up as opposed to be in my PJs.
This is like pandemic parenting mode.
I'm pretty sure I've worn the exact same thing for every podcast so far. Now I'll have to actually dress.
Or that could just be your thing. You could just wear the same thing every time and see how long it takes for people to notice. Like that sportscaster who wore the same suit all year.
Really?
Or what's his face? The guy who does the Adam something or other who does the blue cardigan all the time.
I don't know.
Oh, he's wonderful. And now I can't remember his last name. I'm the worst. All right. So what are we drinking here today? I'm just drinking I'm having an Americano, and I'm also choosing to hydrate because I have not drank a lot of water yet today. So I have my big pineapple cup full of water.
Where's your coffee from?
Our coffee maker in the kitchen.
You know what I want you to say.
You can say it if you want to shamelessly plug and
I
look
will
for
shamelessly
sponsorship.
plug them because they're amazing. Phil and Sebastian's Coffee Roaster in Calgary, Alberta. Not sponsored, but one day maybe. But they're just really good coffee, and we really like good coffee.
And we like
so
it
I want to
delivered
share.
to our door.
Well, yeah, that too.
That is
But
nice.
I want to share our coffee because we like our coffee,
Yeah, we do.
and it's really good.
Yeah.
And if you buy just a normal amount, it doesn't really cost that much more than going to the store and buying good coffee from the store.
And it comes right to your door every time.
Yeah.
It's very nice.
Yeah.
I don't complain about that. That is for sure.
So you're having an Americano. I'm
I
kind of
am.
having a steamed version of the drink I have last week or yesterday, depending on the time frame of what's
So you're
happening.
having an eggnog latte with a shot of Kahlua in it?
Yeah.
How lovely is that?
It's lovely.
Merry Christmas. Cheers to that.
Cheers. There we go.
You make me reach so far. My arms are so short.
Yep. So this week,
This week,
what did we say we were talking about?
we are going to talk about something that sort of came up in our last podcast. We are going to talk about asking for help and delegation
yes.
in your nursing care. Because that's
a big one. Oh, especially for new grads. You don't do it. And it's really hard to learn to do it and not feel guilty about it. But if you can learn at the beginning of your career, then that's a really good tool to have in your toolbox.
Yeah. It's a hard one to teach too, I will say. That's always something that is a struggle to figure out how to teach when I have preceptor students. That balance of you're here to learn how to do your own work and to manage your workload because everybody else on the floor has a workload too, but you are in a team environment for a reason. You can't do this all on your own. There are going to be times that you have to ask for help, and teaching that balance, a lot of students are often on the side of never asking for help, but there's, occasionally there's people who are all too excited to ask for help and, not learn how to manage their own workload.
Yeah.
And that can be tricky to manage too.
What I find always funny about when I'm trying to teach my students delegation and asking for help is, okay, so I'm working with this preceptor student. They have the team. I'm just hanging out at the desk for the most part. maybe helping my colleagues out, blah, 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 or doing paperwork or something, but usually just sitting at the desk. And I always tell them, your job is to ask me for help or maybe the other student. I think that those are the two appropriate people. You don't go and ask another RN on the floor for help. They're already busy. I'm sitting here, ask me for help. But I'll turn my head for 2 seconds and have a conversation with somebody, and my student's asking another nurse for help. I'm like, I was right there.
Oh, but people didn't want to interrupt you.
And I have this rule.
Yeah.
You ask me for help, but big scary Dave, I guess nobody wants to ask me for help. Or they won't ask the other students. I'm like, the other student is there to learn as well, to delegate and to take things on extra. That's the job. That's why you guys should be delegating and asking each other for help. And they do. But I always think it's funny that they won't ask the one person that's sitting there that is like being paid to sit there to help them. They won't ask me for help. But maybe that says more of me being scary than anything else.
Maybe. Just got to put a smile on your face at work more often, Dave. So what do we mean when we say delegation, by the way? Because that's a term that actually carries legal weight.
Okay, if it carries legal weight, give us the legal definition.
Okay, well, we'll just pull this
Okay,
up from,
here,
like,
I'm gonna say what
Yeah.
I think delegation means.
Yeah.
And then and then you can tell me the actual legal term. So delegating is when you are unable to perform a task for yourself, either for timing wise or whatever reason is happening that you can't perform a certain task. You delegate that task. You ask for help from another colleague of yours to go and do that task.
I was looking up a couple of them. This is what the CNO, like the college from Ontario, defines it as. It says delegation is a process by which a healthcare professional who has legal authority to perform a controlled act transfers that authority to an unauthorized person. That sounds like that's
weird.
Yeah,
so
that's
you
weird.
can ask like a porter to do something that's not in their scope.
I feel like no.
I feel like that's not.
No.
Like I would never ask a non-nurse to do a nursing duty.
No.
I would just ask another colleague to take over a job for me if I was unable to do it for whatever reason.
Yeah. I think you have to perform it to someone who's maybe like not authorized, meaning like it's not their patient, they're not the primary nurse, but they're still competent.
Yeah, it's still in their scope to do that job.
Exactly. I think that's more of what it comes down to, is that you are passing off a task that is maybe it's within your workload and your assigned patient load to somebody else who doesn't have that patient load but is still competent to perform that task.
Yeah, like they're not the primary care nurse, but they're still going to be doing something with your patient. Yeah.
So let's talk about trying to teach appropriate delegation. What is and what isn't appropriate to delegate?
So don't go on break and ask for them to do 10 things that can all wait while you go on break.
Yeah.
That's my biggest thing.
Yeah. Or my other thing, I think, is if you have multiple tasks that have to happen at the same time.
That have to. There's not many, but sometimes it is.
Sometimes you have someone in a day, maybe at the same time someone's ringing from the bathroom, somebody else is getting picked up by a porter and needs help getting to a stretcher, and somebody else, you've got an infusion running on and you have to go check vitals on at a certain time, and it all happens at once. That's actually not entirely uncommon.
No. And because you can only control really one of those things.
Yeah.
The portering and the bathroom thing you have no control over.
Yeah.
But you need to be there.
When I'm talking to students about how to manage a situation like that, I always say you choose the task first and foremost, whatever is going to be the most clinically significant task, or the outcome of which might have the most clinical significance. You as the primary nurse need to be there for that.
Yeah.
So, and if all things are equal on that respect, if none of these are like super clinically important circumstances, then you delegate the easiest task to somebody else, and you do the hardest part of your own workload.
You don't delegate the poop explosion to somebody else.
You delegate the go push a pain med for this one patient, and I will deal with the poop explosion. Or if you have someone who's running they're getting a blood transfusion or something. Well, if their vital signs are off, clinically that's quite significant, and you're going to need to manage that. Yeah. So you should do that and ask a coworker to help someone up to a stretcher. That sort of mentality.
I mean, and sometimes.
That's what I teach.
Sometimes the poop explosion is the least clinically important choice.
Yeah.
And so you do need to ask somebody to take care of that.
I'm so sorry.
Right?
I will
And
get you back,
you,
but
you
please.
buy them a coffee or something
Exactly.
after for it.
Give them their own
Especially,
poop
you know, there
explosion.
are floors that have carriage, and right now, thankfully, on our floor we have a carry because of the pandemic and hallway beds and stuff. But you know, typically we're an RN only floor, and so even those personal care jobs,
Yeah.
duties,
Yep.
would be an RN responsibility.
Mm-hmm.
And you would try to you don't want to delegate the thing that's time intensive or just a job that everybody hates when there's no need for you not to do it.
Yeah.
But if you're dealing with a pre-code and there's a poop explosion, somebody else has to go deal with the poop explosion so you can do with the pre-code
Yeah.
on your patient.
Yeah. But for all our non-medical people, by pre-code, we mean like a code, we usually mean cardiorespiratory failure. So somebody's heart stopped, somebody stopped breathing. A pre-code is when people are essentially very rapidly physically declining, and we're trying to manage that to prevent that cardiorespiratory failure. So
Which on oncology does happen quite often.
it does. I think we work very, very hard not to have codes on our floor. They do occur, but it does mean, we end up with a lot of emergent situations where it's very hands-on and very intensive as you're trying to help somebody restabilize.
Well, to toot oncology's horn a little bit, like I've had ICU doctors who have told staff members to not complain about oncology calling them for help. Because by the time oncology involves ICU, they've done over and beyond what almost any other unit in the hospital will have done. Because our patients are sick,
Yeah.
and we've gone through codes enough times that we know how to do a lot of things that prevent code.
And how to recognize things early, and that is a skill, and that's both like textbook knowledge as well as intuition that comes from that constant experience of this person doesn't look quite right.
Yeah.
What should we be checking? What should we be looking for? What are things that we could start doing to intervene early? My friend, the emerge nurse, would always say, "Put in IV access early."
Always.
18 gauge.
Oh, 18 gauge.
18
right.
gauge.
18 gauge.
Get extra IV access right
Man,
away.
We should have called ourselves the 18 gauge podcast for the amount of times we're talking about this.
Yeah. Anyways,
But
so getting back to delegation
I
and
wanna-
asking for
I
help.
just want to say real quick, though.
Yep.
While I'm tooting oncology's horn, I'm not belittling any other unit. I'm just passing along what an ICU doctor has told us is that, when our patients come to them, they know that they're actually extremely sick and have been for a long time, and they've been managed well on the floor. So if they're needing to come to ICU, they need to come to ICU, which is not necessarily the case from other floors from what I've been told.
Well, all right.
We pull the trigger a lot later
Yeah.
is all.
Okay. Well, that aside, getting back to
So I just don't want to offend anybody.
no, that's fair. That's fair.
Every unit
We're not
has their own
knocking
parameter.
anybody.
Yeah.
Yeah,
We love you all.
we do, and
Especially the nursing nuns.
we're yeah. Why do you keep bringing it back to that? Like you're giving me this like little half wink every time you do it too. I'm like, what does that mean?
I don't know. You're in black and white today.
I am.
Maybe
I am in black and white. I didn't think about that.
Maybe I'm having a thing right now.
Okay, well, it's a good thing we're not filming this. Let's move along. Let's talk about the importance of asking for help, because this is also a hard one, I think, not just for new grads and students and stuff, but for nurses in general. A lot of nurses, it's difficult just because, we want to do stuff ourselves. We want to be responsible. We don't want to like offload stuff on people unnecessarily. And we want to prove that we're competent professionals.
Yep.
And that doesn't really, I feel like that doesn't really change over the course of
No,
of a
I've been
career.
doing this for 15 years, and I still even when my team's going sideways, I still hesitate to ask for help.
Yeah. Because you want to be competent. You want to show that you can handle it, right?
Yeah, and the thing is for the most part, I can handle it. But do I need to burn myself out handling it when other people are just like hanging out or can lend a hand and not put their team at risk and whatnot?
Yeah. And I think it is really important to grasp, especially early in your career, that healthcare is a team approach. It's very rare in healthcare that you are truly on your own doing your own thing. You're almost always existing in some sort of team environment, which means you've got to learn to work together, which means learning to help out, but also learning to ask for help.
Yeah.
And this is something I think, especially in emergencies, is a hard one to get through in the first few years of someone's career, because if you haven't seen something before,
Yep.
a lot of times you just you totally get caught up in that moment of, oh my goodness, something bad is going down in front of me, and it's, you kick into fight or flight, that adrenaline hits, and you just start doing and whatever and stuff
Yeah.
in front of you, rather than hitting the call bell, or even just ducking your head out into the hallway and just saying very out loud, I need some help down here.
Yeah.
And I think it's always important to involve your team in what you're doing. Even if it's asking for hands-on help, great. But I think it's also appropriate to ask for help in terms of your thinking, and verifying that you're like, hey, I'm noticing this going on. This is what I'm thinking is happening with my patient.
Yeah.
But it seems important. I'm going to talk to other people about this. And
Sorry.
I was going to say, and that way, number one, you get other people's experiences and perspectives on things. Also, then the rest of your team knows what's going on the floor, because there's nothing worse than, I feel, as another nurse on a team, somebody goes on break and you walk in and their patient's in a really bad state, and you have to call someone back from break thinking that this is a new emergent situation. They're like, oh no, they've kind of been doing this all day and you didn't have that heads up.
Yeah.
And and now suddenly everything's in a scramble because we're all trying to figure out what's going on with this
Yep.
patient, rather than knowing, hey, I'm worried about this patient. They don't look good.
Yeah.
Yeah. Everything's fine right now, but they don't look good. Go ahead.
Yeah. I
Sorry.
forgot what I was going to say when I was not actively
sorry.
listening. I apologize.
I keep thinking of that. I mean, it's a cliche sort of dumbing down of a proverb, but that line that people say, that if you want to go fast, go alone, but if you want to go far, go together.
Yeah.
And I think if you want to power through and prove that you're a rock star and whatever, sure, try and do it all on your own. But if you really want to provide really well-rounded patient care, as well as be a good teammate and have a sustainable career, you need to learn how to ask for help.
Yeah. I think you're with a really good team of nurses when you see them talking to each other all the time and be because there's so much information that nurses have to retain. I tell everybody, there's no way that I retain the information that Julia retains, and I don't care to. But I do know where to look for information or when to ask help for information. I'll just have a brain fart about something at work. And a lot of nurses will be like, is this what this is like? Is this what we're supposed to be doing for this? How do we do this procedure again? You'll see the good experienced nurses talking to each other just to kind of touch base and remind each other how we do things, or be like, I don't quite remember the steps. Can you just walk it through with me real quick so I can go and do this properly and stuff. I think that's the sign of a really good experienced nurse, where they recognize there's too much to remember, and they're always just checking in with their team. That lets their team kind of know what is going on with the other patients. And you're just always touching base and not just trying to wing it.
Yeah. Yeah, I agree with that. I think something you taught me very early on is that there's a lot of power in being able to say, I don't know.
Oh, yeah.
And not just willy-nilly being like, I don't know, thoughtlessly saying, I don't
be
know.
just your first response to everything.
No. But if you genuinely don't know, to admit that you don't know, and the power in that is following it up with not just, I don't know, but I will find out.
Yeah, it creates a teaching moment or a learning moment.
A learning moment, for yourself. And maybe a team member can step in and fill that gap for you, or maybe you need to go and find that information for yourself. But the I don't know is an opportunity to ask for help as well. And here's another thing that I see a lot of new nurses struggling with. I don't know, this suddenly became a rather new nurse focused podcast.
It's because new nurses tend to struggle with this the idea of asking for help most. If you're an experienced nurse, you not asking for help, that's kind of that's more of a personality thing than an experience thing.
Yeah. Okay. Fair enough.
And I don't know if you would ever get a nurse who's been on the floor for 20 years who is just like, I just do my thing. I don't know if you would ever get them to change and ask for help.
Change and ask for help.
But they also have the experience to back that up.
Yep.
Right. So
I see this a lot with, nurses who are in their first year or two of their career. they've gotten, like their day has maybe got a little bit away on them, or there's just been a lot been going on, or something has just occupied a lot of their time. A patient has been less well than they thought. They have a particularly heavy team, even though we try and balance out team assignments. Maybe just one team happened to be heavier than another. What are you looking for?
Nothing. Go ahead.
Okay. And they're like sitting at a desk trying to catch up with charting, or they're running around with their head cut off, essentially. And there may be one or two other nurses around who happen to have, just by sheer experience and just being more experienced nurses, being better at their jobs in the sense of organization and the managing the flow of their day, happen to be like sitting at the desk. They offer to help.
Yeah.
It's okay to say yes.
Yeah.
And I think this comes down to the same sort of thing with delegation. Don't give people like the least desirable task on your list, if you will.
Yeah.
But it's okay to say, yeah, I could do all of this on my own, but I haven't taken a break, or I want to go home at time, or it's really important that I catch up with my charting and no one else can do that for me. Can you go check vital signs for this
Or heck,
patient?
even all of those things are fine, and you're doing okay. You just have like 3 people to give meds to, say at 2:00.
Yeah.
And your colleague has no meds at 2:00, or everybody's off the floor, and they're saying, "Hey, do you need any help?" There's nothing wrong with being like, "Yeah, do you mind doing this for me?" Absolutely. You could do it by yourself in 5 minutes and have it all done. The other person is just sitting there saying, "Do you need help?" There's nothing wrong with saying yes. There's also nothing wrong with being like, "No, I just want to stay busy because I'm going to get bored."
Yeah.
And a lot of times that's why nurses won't ask for help, in the slower times and stuff. There's nurses who like to stay just constantly moving, and then there's nurses who like to kind of come and go.
Yep.
It's each your own, but there's nothing wrong with accepting help when it's offered.
Yeah, exactly. Yeah, especially if people are willingly offering it. It's going to come back around. Fear not. Other people are going to have busy days where you're going to need to step in and help out. It will balance out in the long run. It's okay to accept help when offered as well, not just asking for help. So, but I think I want to circle back to that idea of like an emergent, urgent something sort of situation. I think especially as newer nurses, you just get really wrapped up in the moment.
Yeah.
You need to call out for help.
Yeah.
If something's going down, you think your patient might be crashing, if they've stopped breathing, if they have fallen, all of the above, just call for help and use your voice.
Yeah.
Just project. It's okay to yell for help if you really need help.
Yeah. So
Yeah.
I want to kind of build on that though, and say that's with a little tiny bit of a caveat that I try to teach my students. Of course, if you're in a room and just, your patient goes sideways and you don't know what to do, the worst thing you can do is freeze.
Yep.
So just yell out for help and get anybody in the room to help you sort out things. But if you can, I try to tell my students, like, before you ask for help, you need to take a second and just take a quick breath and think clinically about your patient. A lot of times, especially new grads, when something starts going sideways, they kind of like, their brain kind of like shuts off and they can't clinically think about your patient.
That adrenaline
Is
just
this
kicks in.
actually an expected reaction or outcome of your patient? Is this something that's happened before? Do their core morbidity say that this was an expected thing to happen? Like, they're having a cardiac event, or all of a sudden they're having shortness of breath because, I don't know, they have pleural effusions and we know they're waiting for a chest tube. Right? So I always try to say, like, you have to take a second and clinically try to, I always try to have the clinical picture of my patients in my head when I'm seeing them. So when something out of the norm happens, I can judge it against their clinical picture. What's their diagnosis, what they're there for, what their comorbidities, how have they been in the past, and kind of have that mental picture of them always sitting in my mind. So when I'm in the room and something happens, instead of immediately calling for help and everybody coming in, because when they come in, the people come in to help you, you need to be able to tell them what's going on and what their clinical picture is. You need to have that. That's what happens in a code. You call a code, the code team comes down. The first thing they do is pull you aside as a primary nurse and say, tell me about this patient.
Yeah, because nobody else knows anything
And you
about
have
them.
to have that picture kind of always there. So I'm saying when you call for help, try to have taken a second and just think about the clinical picture so you can know what kind of help you're asking for. It'll get you the proper help a lot faster. Also, instead of necessarily being like nobody knows what's going on, there's this abnormal thing that's happening. Say somebody's BP is suddenly through the roof. You call for help. It's a bunch of people just running around, and you're like, oh, this person's through the roof. I'm going to call the doctor and we'll get some stuff.
Yeah.
If you clinically know that this person has a cardiac issue, they've always had one, maybe check their PRNs and see if they have things for high blood pressure first, right? If the person has a comorbidity that's a known issue, they probably have some sort of meds to help when that rears its head. So the better way to ask for help is be like, hey, this person's this. Can you see their MART if they have, say, in a case of a high blood pressure? Do they have a captopril or an Ativan or something that I can do to help bring down the pressure while we call the doctor?
Spray, yeah.
To then get more help, right? So then you're actually helping the patient quicker, as opposed to waiting for the doctor to pick up the call and maybe writing a double order and then realizing they have the med and stuff like that. So I'm saying when you ask for help, you always try to have the clinical picture in your head of your patient, so you know the better questions to ask when you're asking for help, which is really hard as a new grad.
Especially in the moment, if you get overwhelmed by, again, that fight or flight response kicks in, especially if it's something new that you haven't seen, because experience will really help you mitigate that fight or flight response and make sure it's appropriate to the situation. But if this is all new to you, that kicks in a lot stronger. That essentially it floods your brain and shuts off the left side of your brain and the ability to rationalize. That's another reason to just stop, take a nice deep breath, try and get some of that fight or flight response to die down for a hot second so that you can actually think clearly.
That's kind of like what you were saying, like go slower to act faster, whatever you were just saying.
Oh no, that was about going together to go further.
Yeah, but it's kind of the same idea. Is like if you go slower, you take a second to actually breathe and let your brain not be flooded, so you can do a better job. Then when you ask for help, you can get more people involved the proper way, as opposed to everybody running around not quite knowing what's going on and defaulting to calling the doctor instead of getting the meds that the doctor's already ordered and stuff. That's all I'm saying.
Okay.
This part will be cut out because it's just weird awkwardness.
I'm not sure what to say next. I thought we were talking about asking for help, and now we're talking about, rationalizing your clinical judgments.
No, but it's a very important part of asking for help. Why are you asking for help?
Okay.
Right? Don't just ask for help for the pure sake of asking for help. You need to know, as the primary nurse, you need to know what help you're asking for.
Yeah, that's the point.
And sometimes it's, my brain is fried. I don't know what to do. Somebody come and take over. That's literally the help you're asking for.
Yeah.
Right? But you want to be able to ask for help in the most effective way possible. And in doing that, you have to know what you're asking for. Right?
Okay.
Just asking for help doesn't do anything. That just has a lot of people running around trying to figure out what's going on. Well, you're the primary nurse. You should be telling them, I need this.
Yep.
Help-wise.
Yep.
Right. So that's kind of what I'm trying to say is, as a nurse, when you ask for help, you want to ask for help in a very directed way, and not just be like, brain's done, somebody come in, take over.
Yeah.
You don't want to do that. Sometimes it has to, and that's the best case for you and your patient, for everybody to stay safe.
Yeah.
When you are just so far beyond, especially as a new grad.
When you're just out of your depth.
There are going to be times that you are so far beyond your experience level that you probably shouldn't have had that patient in the first place. That does happen. We have a lot of new grads. You have a lot of turnover and stuff. That's going to happen in your career, where sometimes you have a patient that you shouldn't have. And you need to be able to be like, this is too far beyond. I don't even know what to do here.
Yeah.
And get somebody to come in and be like, you actually need to, and hopefully you do it before there's a problem.
Yeah.
But you actually need for help and be like, you need to take this patient from me because I am uncomfortable, because I don't know what to do if something does go wrong.
Ooh, that's a good point to make about asking for help as well. Sometimes asking for help means changing team assignments. For balancing out workload, or, your ability to provide appropriate care for a particular patient. Sometimes that's the type of help that you need to ask for. And that can be very hard as a new grad, because you don't want to seem presumptuous or seem like you can't keep up with your workload. But if you have so many things going on a team all at once, and it's just going to overwhelm your ability and your experience level, then that's a type of help that you might need to ask for as well.
Yeah, you want to
It's
keep yourself and your patient as safe as possible, and sometimes that means not being the primary nurse.
Yeah, and it is okay to ask for that.
Yeah.
You know, I would say, especially if you've got an in charge or someone in leadership making those decisions on your unit in terms of the patient assignments, you would hope that they are giving it careful, considered thought and they're doing their best to balance it out for everybody. So I would say you don't want to be in the habit of always asking to change your team. But if you are in a moment and you're like, this is just beyond me, it's okay to ask for that type of help.
I think as a professional, you have a responsibility to know what you can and cannot do. And when you're being asked to do something beyond your experience level, you need to speak up.
Yeah.
And sometimes it just might be like, hey, for this part of my day, I don't know what to do. Can you help me with it?
Yeah.
Right? And I can manage the rest. Or this patient is just way too complicated for me while having 6 people.
Yeah.
I can't manage this heavy person and everything else going on.
Yeah.
Right? Because that's just kind of the state we're in these days. Everybody's, overworked with extra patients and stuff. And sometimes that patient load is too complex for you.
Yep.
Yeah.
That's okay to ask for that form of help.
Yeah.
Be gracious about it, but
Yeah.
ask for help.
Yeah.
Yeah. And just know that, like, when you're asking for help, ultimately what you are doing is you're putting your patient care first.
Yeah.
Ask for help because you want your patients to get the best possible care. Then nobody's ego is involved in it. It doesn't need to be a pride thing or something you need to be ashamed about. You need to be honest with yourself and what your capabilities are and what your limits are for the sake of your patients. And when you're asking for help, you're not just doing it because you're an incompetent person. You're doing it because you care about your patients and them getting the care that they need.
Well, there's kind of a thing that like experienced nurses talk about when they get new grads on the floor, right? Like right away, you can tell if that new grad is going to be a good nurse or a nurse that's going to struggle.
Yeah.
And the nurse that asks questions when they're new, asks questions, asks for help, is always talking, is going to be the nurse that more experienced nurses are comfortable being around because they know that they don't have to worry about them. Because if something comes up, they know that they're going to come and talk to a more experienced nurse about it.
Yeah.
It's the new grad that doesn't talk. The new grad that doesn't ask for help. The new grad doesn't ask questions.
Yeah.
Is a bit of, they might be just superstars and be all good. And, they might have other life experiences that, help them out. Like say you transition from an LPN to an RN or something like that.
Yeah.
So there's always the exception to the rule, but the new grad that doesn't ask questions and doesn't ask for help
Yeah.
is the one that more experienced nurses are actually weary about working with, because then they're kind of always in their back of their mind thinking about this other team, and is this other team doing okay or
Are they
not?
okay? Are we going to
And
be
it's-
surprised
and
by
it's-
someone tanking?
Yeah, and it's making them expend mental energy on other things that aren't their own team.
Yeah.
And it makes your day harder.
Yeah. I whenever I get, if I'm orientating a new grad or something like that, someone who always apologizes about asking a lot of questions, I pretty much will always say, I'm like, you know what? Nurses it is less of an annoyance to nurses to have a new grad who asks a lot of questions than it is a red flag to have a new grad who doesn't ask questions.
But in their head, it's the opposite.
Yeah, exactly. And when you're a new grad, you think if I'm asking a lot of questions, people are going to assume that I'm not competent, that I don't know how to do my job, that I don't belong here. It's all that imposter syndrome stuff, et cetera, et cetera. You're trying so hard to prove yourself, and you feel like it's going to be a red flag if you're asking questions. People are going to think you don't belong here and you're not good enough. But from the more experienced side of that equation now, I definitely will say I much would rather work with someone who asks a lot of questions.
Yeah.
And, makes their own decisions, but is willing to check in with other people to make sure that they're on course,
Yeah.
than someone who doesn't ask questions at all. That's scary, actually.
Yeah. When a
That's a
nurse,
safety concern.
when I'm talking to a student of mine about asking questions and stuff, I'll point out, be like, look at these other nurses that we're working with, these other experienced nurses. See how they're talking to each other. They're asking questions all day long about little minute details that we just don't quite remember, or that right now I'm having a brain fart, so whatever word I'm trying to think of. But
But
you're
little
having a
things in
brain
their
fart,
day. Yeah.
and you're just asking for help to be like, can you just clue me into this again? Because I can't quite remember it, and then I can go on and do my job. And I try to point that out. Be like, if you look at your experiences, nurses, they are talking to each other all day long about the floor, about the job.
Yeah.
And that's how it should be.
Yeah. And I also want to say, like, there's that phrase we throw around about no such thing as a stupid question. Because I really do believe that that's true. There's no such thing as a stupid question. There are such things as lazy or thoughtless questions. Yeah. So when I'm working with someone, if they're ever apologizing for asking a lot of questions, that's usually my comment for that too. I'm like, well, if you need help figuring this out, that's not bad. If you don't know something at this point, that's not a problem. If you haven't even bothered to think about it at all or tried to problem solve, like try and come up with an answer and ask if your answer is, appropriate for the situation, rather than just sitting there and being like, I haven't even thought about this yet. I want someone to spoon feed it to me. So I think, there's no such thing as a stupid question, but there is such thing as a lazy question or a thoughtless question. Yeah. Don't ask those ones.
That's actually like one of the main things I try to do with my students during their preceptorship, other than take your breaks.
Yeah.
Get up to the full team, is when you come to me and ask for a question, did you do your due diligence first?
Yep.
If you're running around and you just really need help with help answering this one little thing, and I can see that you're busy, and me giving you the answer for this one thing will just help everything flow, that's fine. But when things aren't crazy and you're asking for help, did you go and look at the learning or at the clinical skills resources that we have? Did you do your due diligence to try to find an answer before asking a question?
Yeah.
Because our employer gives us a lot of different resources to answer questions, and like I'm just sitting there. So with my students, it's easy to just come to me because I'm just there. But when when you're on the floor working as a nurse and all your other nurses are also busy.
Yeah. No one's sitting at the desk.
Nobody's sitting at the desk. They're all doing their job. You don't necessarily want to interrupt them first come, first serve. You need to go on the computer. You need to grab a textbook from the back. You need to look something up for yourself first. And only once you've done your due diligence and you still can't quite find the answer, then ask for help.
Yeah.
Being in an emergency situation is different, of course.
Yes.
Or if the nurse is just sitting there, and be like, hey, looks like you're struggling. What do you need help with? That's different too.
Ask for help.
But you should be doing your own due diligence, because nurses are always learning. Our procedures are always changing. Our policies are always changing.
Yeah.
It's your job to be on the ball with those. And that means looking at your emails to see if we get a policy change or something, or knowing how to use the skills resource to be like, I haven't done a pick change in a year. I can't quite remember the steps. Let me look it up real quick and then go and do your job.
Yep.
Yeah.
Yeah. No such thing as a stupid question, but
Now,
think about it first.
I am going to say this.
Yep.
And I've only come across it once in my career. And if you're listening, I love you. I understand why it happened. But when you ask other nurses for help and you ask them for answers and questions, and and then you ignore their answer, and then you ask 3 other nurses for the answer, then you ignore them and you call the doctor and you ignore them, and then spend an hour looking things up online, don't be asking for help in those situations. If you're not going to listen to the answers that you're given and trust them, then don't be asking them. Right? Because then that becomes a problem. Right? And I get it. Like, and stress and anxiety play a huge part, especially during the pandemic. We're all burnt out, personality-wise, etc. So, like I said, it doesn't happen all the time, but it has happened. That can get really frustrating for your team members. It's not that you didn't need the help. It's that you trusted nobody when they gave you the answer that you were looking for. Right?
Trust that you're surrounded by competent individuals. Yeah.
Because eventually everybody's just going to stop wanting to answer you.
Yeah. And stop wanting to
And
help
it's
you.
kind of like the boy who cried wolf at that point. Nobody's going to want to bother working with you because it's draining to be asked and then just ignore it.
Yeah.
Right?
Yeah.
Like, if you're not going to respect my answer, why are you coming to me in the first place?
Then maybe you didn't need my help at all.
Right.
Yeah.
And I get why in this particular instance it's happened. And like I said, there's just certain things about, when you're stressed and anxiety that you can't control and stuff. But It is something that you want to be cognizant about, is not asking for questions and then ignoring the experienced answers that you get.
Yeah, that's a good point.
Yeah.
Yeah. If you're stressed about something enough that you need to ask for help, trust that somebody else is really actually trying to help you.
Yeah.
Yeah.
So with asking for help and delegating, because it's
A little bit of,
maybe delegating is the more formal.
I think it's the more formal.
formalized way of help
Yeah.
of asking for help, right?
yeah.
Like it's like the codified college version of asking for help.
Yeah. Position papers on it, et cetera, et cetera.
It is a fine balance. You want to show that you're competent and you can do your job.
Because that is your job.
It
It
is
is
your
your
job.
job to manage your workload, to take care of your patients.
But you don't need to burn yourself out and put your patients at risk to show that you're competent. Asking for help actually shows that you're competent.
yeah.
Delegating shows that if you learn to delegate your work appropriately, it shows so much of who you are as a professional. It shows that you know how to keep things organized. It shows that you can keep a complex series of events properly prioritized in your brain and get the help that you need to keep those things flowing.
Yeah.
It actually shows so much of who you are as an experienced nurse
Which a lot of
to
competence.
properly delegate,
Yeah.
properly ask for help.
Yep.
It's when you don't that, okay, you can get through your day and do it all, but if you're missing breaks to do it, if you're charting on your breaks, if you're staying late, are you actually acting as the most responsible professional you can be? Right? I would argue you're not. You're putting your patients at risk because now you've worked a 12-hour shift. You didn't give your brain time to reset.
refresh. Yeah.
You're staying late to finish charting and stuff. You're charting from things from 12 hours ago, which is not best practice because you're not going to remember it all. And then you're going home late. And then so your home life is going to be affected. If you're coming back on shift, you're not getting the rest that you need at home. So I would argue that trying to be the one that never asks for help and whatnot, that's actually more detrimental to your flora and your patients.
Yeah.
Yeah, even if you are managing it, you're not actually managing it because you're sacrificing a lot of your own well-being to do it,
And
and that's going to cause a problem.
the body keeps score, and that is gonna add up over time.
You will make an error at some point when you get to that point.
Yeah. Or you will suffer in your overall well-being and your enjoyment of life, period.
Yeah.
Yeah.
Unless you're a little Energizer bunny.
We've worked with one or two of those.
Some people who literally, they're always at that level and they're always charged and ready to go. And that's just how they operate. So like I said, it's
Most of us are not those astounding people.
Yeah, but we see them and we think that's how we should be acting,
Yeah.
especially as new grads. So that's what I'm saying. Like it is a hard one to teach. It's a hard one to learn.
Yeah.
There is that balance, and nobody can really teach you for yourself what that balance is. It's different for everybody.
And it's different every day,
And,
I think.
and it's different every day because
Yeah.
working in acute care, it changes minute by minute sometimes.
Yeah.
So we're trying to take a very complex idea and distill it down to, you need to be, as a good nurse, you need to ask for help. You need to delegate. But as a good nurse, it's up to you to find that right balance for you and your practice.
Yep.
Every nurse's practice is different. That's what I always tell my students when they're in their preceptorship. I'm like, this is the 4 months that you have now to take all the learning that you've done in the last 3.5 years and learn how to consolidate that to make your practice your own. The way that each and every single nurse does their job is different. We're all taught the exact same, but there's no nurse that works the exact same as any other nurse.
Yep.
Your personality plays into, there's so many different factors. And so learning to ask for help, learning to delegate is a portion of your practice, and you need to learn how to do that is best for you.
Yeah. I like that. I think maybe that's a good point to wrap up on.
Sure.
Yeah. Any other last takeaway thoughts for the week?
I feel like that was just my last.
That's your
takeaway
last
thought.
takeaway thought? Okay, what's my takeaway thought? Yeah, I like what you said about knowing how to ask for help and delegate appropriately shows your competency. And I also want to say again, take your ego out of the equation. At the end of the day, this is all about your patient. You're showing up to be the best nurse that
Yeah.
you can for someone who is there in a vulnerable position needing you.
Mm-hmm.
So take the ego out of the equation and do what's best for your patient and learn how to ask for help when you need it and how to accept help when it's offered.
So it kind of ties into last week's talk about forming habits. Get into the habit of asking for help, and over time mold that into the way that works best for your practice.
Yeah. Yep. I think
There you
that's
go.
good. We didn't say this at any point during our
We always
podcast
forget.
again, but
We need to put it on the little button. Go,
we do a little button in the middle. We have a little interlude, but we'd love it if you'd like, subscribe, leave us stars, leave us reviews. That's so wonderful. And reach out to us on socials. It really makes our day.
You can find us at www.the24gpodcast.com and at the 24G podcast on most social things like Instagram and YouTube and stuff. Mm-hmm. And hopefully we'll bring you a video podcast starting up in the next couple of weeks.
In the next couple of weeks. Happy 2023, everyone. I hope it's going to be a wonderful year. And even if it's not, we're still going to be here with you through it all.
Yeah. All right. See you later.
Bye.